Hello, friends. Welcome to Creative Medicine. In this lecture, we will learn about
Diagnosis disorders to be ruled out in polycystic ovarian disease. Idiopathic hirsutism. In idiopathic hirsutism, levels of androgen will be normal. Androgen secreting tumor of the ovary should be ruled out before thinking it to be polycystic ovarian disease. Late onset congenital adrenal hyperplasia or non classical congenital adrenal hyperplasia should be ruled out. You should rule out congenital adrenal hyperplasia by measuring 17-hydroxyprogesterone to differentiate from polycystic ovarian disease. So we should rule out idiopathic hirsutism, androgen secreting tumors, and late onset congenital adrenal hyperplasia.
thank you and thank you for watching.